So here we're going to do the technique of the deep six. We call it the deep six, but primarily we're going to be focused on the piriformis. The piriformis is located on the medial side of the sacrum, and it anchors on the anterior portion of. So if the sacrum is here, it's anchored on the underside. And it normally has three digitations, so it could be S1, 2, 3 or S2, 3 and 4. It makes its way down to the greater trochanter here. So the way we palpate this muscle, we find the PSIS and the inferior lateral angle of the sacrum. And we come here, and you see it makes this triangle shape here. So this is where the piriformis is located. So we need to be able to locate the piriformis pretty easily. This takes practice, of course. Then we need to know how to stretch the muscle and slacken the muscle. Greater trochanter, inferior lateral angle of the sacrum, PSIS. So what I'll do, I'll just palpate the way down. So the first thing I do is I'll just palpate the entire length of the muscle, just feeling for any tension, trigger points, or abnormal soreness from the client. How's that feel?
Good.
Of course, we've got to palpate through the glute max and a little bit of the glute med. So what we can do, I don't have a bolster to hand, I do actually. No, I don't have a bolster to hand. We can extend the hip. This will further slacken the superficial tissue and allow us to palpate a little bit easier if needed. So once we've done a rough palpation, again, this is just real quick, we're assessing the tissue. When we're testing, or when we're assessing the range of motion, when we assess the range of motion slowly, we're generally looking at the ability for the joint to rotate, the hip joint. When we test the range of motion a bit more quickly, we're normally assessing myofascial trigger points. So to recap, when I'm checking slowly, I'm checking for the joint's integrity and ability to move. When I move fast and there's an issue, it's normally myofascial in nature. Cut. So the piriformis is primarily an external rotator. So for us to stretch it, we have to go into internal rotation. This always confuses our students. This is internal hip rotation, because the hip is like so, and we're turning it inward. So this is internal rotation. So here we're stretching the piriformis. When the leg and hip is neutral, the piriformis is a very strong rotator of the hip. So the way I'm going to treat this, we already know where our landmarks are for the sacrum and the trochanter. So I come up against the sacral angle, I step back, I bend my knees, I relax my back, and I push at an oblique angle. So I'm pushing this way. So I'm pushing through the tissue of the glute. And when I rock Kiki's leg back and forth like this, I can feel a little bit of tethering, a bit of flickering under my fingers. That just tells me that we're on one of the rotators, probably the piriformis. So I push my pressure in, and I slowly open the hip into internal rotation. Feels okay? I move down 1/2 inch. Angled pressure, this is good for myofascial receptors, always angled pressure. And I hold. 1, 2, 3. Slacken the tissue. shorten the tissue, should I say, lengthen the tissue. So when I shorten the tissue, I release my pin, I pin the muscle, and I come down. Here. I don't know if you can see this on camera, but when I'm palpating with my 3 fingers, I'm trying to hook my fingers like so. So I don't want to be like this, pushing with 1 finger. It's 3 fingers, so I have to hook my middle finger. When we start getting down towards the trochanter, I want to really get in and around that trochanter to really hit that insertion point. Of course, I can use a broad fist. Same rules apply. Elbow straight, bending my front knee, straightening my back. I push down at an angle. I step back, maintain pressure. And here, work our way down. The Piriformis derives its name from Latin. Pira means pear, and formis means shape. So it's like a paired shaped muscle. So it's like so. The Piriformis muscle is is one of the deep 6. It's the most superficial of the deep 6. So you have the Piriformis higher, then you have what we call the go-go muscles, the gramellis and the obturators, which are two of each, and the quadratus femoris, which is the most inferior. So we showed you fingers, fists, we can use knuckles, which I primarily do. So we can have the client work themselves. So I asked Kiki to windshield wipe her foot. So windshield wipe your foot, so she knows what to do. Then I'll come in here. I'll always maintain or get my contact spot so I know where I am. I come in here, and as she comes towards me, we anchor, release, anchor. So this is an active form of body work where they're really participating and assisting. If I'm working on a client who is very stiff, maybe bigger than me, or needs more work, take a shift over to your left, please. I will take a seat. This is a technique I learned from one of my early mentors, Eric Dalton. So what he showed us to do, so Kiki's lying nice and flat, and if they do get a bit out of kilter like they did there, see how she was laying a bit, I'll just come in here, shake and pull, just to straighten her out. Because when you ask clients to move, they'll end up moving in a very weird position. So we always want to try and work on the client somewhat lying symmetrically. So I'll take a seat, and I'm going to use the broad side of my elbow. And notice always come in and get my landmarks. So I'm on the sacrum, so you can see that bumping off the sacrum. So I start the stroke on the sacrum, and I just slide off. And my pressure is this way. I'm going in towards the sacrum. Because recall, as I said earlier, the sacrum, the piriformis, comes from underneath the sacrum. So we can't actually get to it directly. But if we affect the periosteum, we are going to affect the muscle as it attaches onto the bone there. And we work our way out. Notice I'm not so sharp here. So what that means is I'm not coming in like this. I'm not saying you can't come in like this, but be judicious with your pressure. If we want to add range of motion here, we ask Kiki to bend her knee. And I'm going to reach around like so. Here. This is the actual technique that I learned from Eric. So I'm here, I apply my pressure, and I just open my body slightly. So I'm here, I look towards her foot, and I turn and open. So this is great if I think I want to be here for an extended period. What would make me want to be here for an extended period is this: when we done the muscle testing, or the range of motion testing, if she was very stiff and there was a very hard end feel here. So when we open the hip, when we get to the end of the range, it should be a nice, firm ending. So let's say with Kiki, she's super stiff in the hips and she has limited range of motion in this hip. So we get to here and it's a very blocky, hard end. That's going to just suggest some sort of capsular tightness, some sort of fibrosis in the muscle, and or some real awkward tension in and around the joint capsule. So if that was the case with Kiki, I would come in here, I would apply my pressure, I would open her up to about her end range of motion, and I'll just hang out. 1, 2, 3 minutes. And I don't know if you heard Kiki there take a deep breath. If that happens during a session, stay where you are or just back off an inch and just maintain. And then give your client a couple of breaths. How does that feel? Mm-hmm. And I always ask, how does that feel? Better, worse, or the same? Better. Because if you say, does that feel great? Our client will generally lie. So you give them the option to say, no, it actually feels pretty crappy. So I always ask, better, worse, or the same. When you're doing these long holds, release slowly this hand. Release slowly this hand, and then what I'll do, I'll just turn around, come in here and jostle. Then I'll normally do the exact opposite and close the hip just to give us some rest. Piriformis is only several muscles actually get very much cross and get close to the sacroiliac joint. So it's very much involved in sacroiliac dysfunctions. It generally refers a lot of pain into the lower back sacral area as well as the posterior thigh. So when clients come in with sciatic type issues, you always want to assess the quality of this muscle and the quality of this range of motion.